The latest numbers are out. In the last 24 hours. There have been 38,902, so almost 39,000 new cases in a 24-hour period. This is, as yet, India's biggest spike in daily cases. 543 deaths have also been reported in the last 24 hours alone, and that has taken India's overall tally now to over 10.7 lakh cases. Now, there have been also 26,816 deaths as we speak. Now, those numbers, of course, have been worrying, especially with daily spikes being seen well above 30,000 new cases currently. Let's take a look at where those cases are coming from. Well, the top 5 states which are reporting the highest number of daily cases, Maharashtra topping the list at 8,348. And worryingly, it's not so much the capital Mumbai which is seeing that spike. It is now other areas in around Mumbai and indeed even in rural parts of Maharashtra that are now reporting spikes. Tamil Nadu has seen a massive 4,807 new cases. Tamil Nadu and Karnataka and Andhra Pradesh are some of the worst affected states now, with Karnataka reporting 4,500 new cases, Andhra Pradesh seeing 3,963 cases, Assam now reporting over 2,200 cases in the last 24 hours. And as far as deaths go, Maharashtra again topping the list at 144 new deaths, Karnataka at 93, Tamil Nadu at 88, Andhra Pradesh at 52 and Delhi at 26. So are we in fact actually looking at a scenario where community transmission is well underway? What are the big takeaways from the fact that now it's not just the metropolises which are seeing those big cases, but also other areas, including rural areas? Well, joining us for all of that is Dr. V.K. Munga, Chairman, Hospital Board of India and of the Indian Medical Association. Dr. Munga, thanks very much indeed for speaking with NDTV. When we look at these numbers, yet another record high of close to 39,000 cases now in just 24 hours. This is among the highest tallies in the world. What are we seeing here, Dr. Munga?
I think I agree with your report till now. Main issue comes here is that we are passing through a very difficult phase of corona. 39,000, 40,000 daily cases, numbers crossing 11 lakhs, and even deaths, going up day and day. And especially because I'm speaking on behalf of the healthcare providers of the country. And we believe that in all our hospitals, small, medium and large hospitals also, people are pouring in with corona symptoms, especially nowadays in Maharashtra, Andhra Pradesh, UP, Northeast, Karnataka. All these states are doing very badly. The main reason is, number one, the migration has happened in a big way. Number two, now the disease is going into towns and villages, Till now we were talking of Delhi and Mumbai only, maybe some part of Bangalore. But now it is going into the deeper parts of the country where once it spreads, it will be very, very difficult to control it, to diagnose it, to test it and even to isolate it. Because we are a very thickly populated country. And in these situations, I believe it will be a very Herculean task. We should have stopped the things there in the cities itself, but unfortunately, it has gone deep into the, into the depth of the country, and that is a challenge for the country as such at this time.
But Dr. Munga, would you say then that we are in community transmission, and why do you feel that it's been difficult for at least, government authorities to put that on record? I mean, with numbers like this, how can we say we're not in community transmission?
No, I'm surprised the way the government has been doing it. But, examples in Dharavi, examples in Bihar, where 75 people of a political party got tested, even Tirupati for that matter, and even in small hospitals also, when a lady comes for a delivery, her COVID testing is done, it comes out to be positive, and she says, I have not gone out of my home for the last 2 months. Similarly, some elderly people, they have gone out only to fetch some vegetables, even that once a week, and then they get the disease. I mean, all this, what is the community transmission? Community spread is when you are not able to locate the source of the infection. Initially, for example, in Delhi, we were doing contact tracing, we were then isolating, taking the patient to the hospital. But now, all over the country, I mean, there is no contact tracing even for the namesake. So when there is no contact tracing, we don't know where a person has got this infection from.
Right.
And then it is very difficult. I mean, what is this? This is all community transmission, nothing else. And WHO has always said that India, they said it around 2 months back, that India is into community transmission. I mean, it is for the government to answer that why are they not declaring it as a community transmission.